Took a photo, and I have never been more traumatized by anything in my life. Right, how are you, my internet family, and welcome back for another video. I'm going to be answering, very honestly, a lot of your questions from over my Instagram about birth and, you know, after having a baby and stuff like that. I'm going to be really getting into it, and if you're new here, I had my first baby really recently. I'm 31, I had a little boy. A brief recap of my labour and delivery experience. If you didn't watch the video about that, I had a natural labour for 26 hours right up to the pushing phase. I used non-medical pain relief like staying active, and my husband was like massaging my lower back and pressing on it because most of my labour pains were in my back. I tried water immersion, relaxation techniques like visualization and breathing practices, which I learned through a hypnobirthing course that I did. I did aromatherapy with lavender oil during the labour. I started sniffing that as soon as I went into labour. I used the TENS machine, which has electrodes that you put on your back that stimulate the nerves, which kind of distract you from the pain. And toward the end, I used gas and air, which is a mix of oxygen and another gas called nitrous oxide, which it doesn't take pain away, but it kind of makes it easier to cope with. Then the hospital wouldn't allow me to push unguided on all fours, which was what I wanted, and I really wasn't happy about that. Then the hospital intervened after just 1 hour of pushing to say that's how they do things. They intervene after an hour. They said it was taking too long, and because the baby wasn't in the ideal position, I might tire myself out. So even though he wasn't in distress and I was tired but fine, they wanted to try a vacuum, which they assumed wouldn't work, so they needed to do a spinal tap in case they had to do a C-section. And I wasn't happy about interventions, but I consented to these interventions feeling pressured but trusting them because I was in their care. However, then they used a forceps without asking me, and they got the baby out in like 2 pushes, a couple of minutes, because he was already almost out. And in that moment when baby came into the world, baby and myself were perfectly fine. I had a bit of a difficult recovery, which I also made a video about, but yeah, that's the gist. And a lot of your questions are based around things that I talked about in my birth video and stuff, but a lot of them are just really frequently asked common questions that, you know, you would ask someone who just had a baby if you were pregnant yourself or you were just really interested in it. And yeah, let's dive in. The first one that just came up so much, like honestly, a lot of these questions are asking if I pooed during labour. Did I poo on the table? Was I afraid about doing a poo? Like, so many of you were really interested in that. I had to ask my husband because I was in a different zone in the labour if there was any poo situation, and he told me no, I have no memory of that. However, I did pee myself multiple times, but I just did not care. I was too far gone to care. I peed here in the house, I had no control over it. I peed on the floor while I was labouring in the hospital. I peed loads of times in a bedpan, and there was just no shame. It had to happen. So yeah, I do see how a poo situation could occur because you don't really have much sense of control down there during it. But one thing that happens to a lot of women, and it happened to me, is that you kind of have a natural clear out right as you're going into labour or right before it, and it was intense. So I don't think there was anything left. So many of you wanted to know what contractions feel like, and I got a question about how I would rate the pain. I got questions asking like where the contractions were, so the pushing worse, and questions asking, is it true that you forget the pain of labour when you're finished? And like, I know based on things I wrote down in my phone right after it that it was intense, but honestly, right now, if I try and describe the sensation, it's really difficult to, because it is like my brain wiped it away, and I don't understand it because I've had really intense pain before, say like in a nerve in my gums, like when I've needed a tooth out, for example, and I can remember the piercing sharpness of that pain. But with the labour pains, like, yeah, like they came on, and I know it was at that time sort of period pain-ish. I know there's another one coming. But definitely more intense and very much like a wave, like it would rise, peak, and then go. And my contractions, my surges were very typical like that. Like, I always knew that very quickly it'd be done. So that really helped a lot actually to have those pauses between, but they get so bad later into the labour. I feel like 1 to 10, like that rating does not even work. It's like I would draw a circle around the 1 to 10 and I would say that I was in this outer space, different place of pain. And the reason I say that is because it's not like, you know, someone runs over your leg and then you're like, ah, like it is a functional feeling. It's just very all consuming, you know, and obviously because of what's happening, it's painful, but I just was well able for it, and I was making mooing sounds. Like someone asked that, did I moo? Yes, I mooed. I started these low moos early on in the labour, and by the end of it I was like proper like guttural screaming, like exorcist noises, you know, and they helped me to cope with it. And yeah, because I wrote stuff down and filmed certain stuff, like I obviously know that it was really, really intense and painful, but there's no memory saying like, oh God, don't do that again, that's bad. Because if you burn your hand, you're gonna try and avoid ever burning your hand again because it was so bad, you know. But with birth, I'm like dying to do it again. Like I'm actually so excited to do it again. So yeah, I know a lot of people are really, really scared of that because it's the unknown, and that was what made me seek out a lot of descriptions of it. So like cramps, period cramps on steroids is one explanation, I suppose, but for me it was so much in my lower back because of the position of the baby. I did so many positive affirmations as part of hypnobirthing that I just knew I was gonna be able for it. Like one of my favourite affirmations was that my contractions can't be more powerful than me because they are me. Something about that really resonated with me, and I was kind of thinking about the baby coming out as doing a huge massive poo. Like it was muscles doing what they were made to do, and so it wasn't the same as having a knife stuck in a muscle, you know what I mean? So the reason everyone says that it's very hard to describe contractions is because it really is. You do, or at least I did, go into this otherworldly space where you're just kind of not really here. My technique for getting through contractions was I was imagining that I was Khaleesi from Game of Thrones on the back of a dragon, and the dragon was flying higher and higher into the sky to touch off the clouds, and that was the peak of the contraction, and then flying back down to terrorize everyone down below. That visualization got me through so many contractions because I had a lot of contractions. I was in labor for 26 hours. Oh my God. And I will say, I feel like the part where you're dilating and stuff, like I felt like that pain was worse and more intense than the pushing bit, because I don't know, I quite enjoyed pushing. It just felt very, I was just like, this baby's coming, get out, I want to meet you, I want to see your face. Like it wasn't the same like grueling, like, oh God, how much more of this do I have to go, how dilated am I? I just felt I loved the pushing phase. So yeah, that's why I got really annoyed when I was interrupted in my pushing. I had a lot of questions about sex after birth. People asking, was I anxious about it? People asking, while I was waiting to have sex, was I able to do other things? And the truth is, and I was thinking about doing a whole video about this, like let me know with a thumbs up if you'd be interested in that. I haven't done the deed yet because, yeah, very nervous about pain. So we have tried, and yes, like we've been having sex, but just not penetrative. And that is one thing, you know, like I'm bisexual, and I feel that often the word sex is used only to represent penetrative sex, when actually a lot of people who are sleeping with a same-sex partner will not have penetration at all. Would you say that those people never have sex? No. I've just kind of had to accept the way I feel, and I was really nervous about being in this place so long after, like I'm 9 weeks postpartum now, and I thought by the time the 6-week check rolled around I'd be like raring to go, but I just wasn't. I just didn't feel there yet. Not only because I'm so kind of focused on the baby and stuff, and we're kind of in this little baby bubble, this new phase of learning how to be parents, but just like physically as well. Like we'll get into the tearing and the healing in a bit, but yeah, like I just physically it just doesn't feel back to normal fully yet. It looks back to normal, doesn't feel back to normal. And I know that it's typical for sex to hurt the first time you have sex after having a baby, and I'm expecting that, but also I kind of just don't want to push through pain. I just feel like that's something that a lot of women tend to do. Like, they'll have sex even if it's uncomfortable just for the other person, but my husband is very understanding and patient, and we're focusing on being intimate in different ways without penetration, you know, and that's fine for now. But yeah, there was pain when we tried, and so I just wanted to stop straight away. I just didn't want to grin and bear it. Such a weird thing that we do to ourselves. I don't know why so many of us feel this pressure to like get right back on that wagon. It's kind of like the expectation to snap back into your pre-pregnancy body like straight away. Just do away with that shite, okay? Listen to your body and go with it. Would I consider a home birth? This lovely girl saying I laboured amazingly well at home, and thank you very much. I was very proud of myself for how I laboured, and I would love to have a home birth. I actually would have preferred, I think, to have a home birth on my first baby, but my husband was quite anxious about the idea, and he liked the idea of the hospital and the doctors and stuff being there just in case, and I completely understand that. But I think he would be open to a home birth now, having experienced the hospital side of things and knowing that midwives know how to like deal with a hemorrhage or a lot of those things that can happen, and also they will know when you have to transfer to a hospital if they think that you should transfer. Obviously if it's low risk, because if there was any sort of risks I wouldn't have a home birth. But yeah, if I had another low risk pregnancy, I think I would love to do a home birth, because I really enjoyed labouring at home. I felt very safe. We had the fire on, and I was just able to have like my own food, and it's a familiar environment, and you don't feel under any kind of threat. You're not feeling like embarrassed with people coming in looking at your bits. What's the recovery like for your tummy, and did the bump go down immediately? Yeah, my bump just went like immediately after the birth. Shortly after the birth I took this photo because I was just so shocked that my stomach just looked relatively normal. And like, I've never been someone who had abs or anything. I did have a very toned stomach before I got pregnant, but like, I'm used to being a bit fleshy around there, and since I was about 20 I've had body dysmorphia, and it's not that bad anymore, but I need to take a lot of photos because I often don't see how I really look, you know what I mean? A week later it looked like this, so it's still a little bit like my uterus was still out a little bit, still a little bit jiggly, and now it's kind of how it looked before I started going to the gym. So like, except it has one stretch mark on it, and I was asked about what I did about like belly stretch marks and stuff. I just oiled it up twice a day through the whole pregnancy, and I actually stuck to that. Like every day I would do oil. For most of the pregnancy I was using coconut oil products with lavender oil in it, and then at the end it was just straight up coconut oil because I was just spending so much money. I think I spent €130. I added it up. I spent €130 on different types of oils that all went directly onto my bump, but I really think that they made a difference because I know that like there are stretch marks in my family, and I have that kind of skin that gets stretch marks. I have them everywhere else, so I was amazed that I didn't get loads of them on my belly. I know it's anecdotal, but there's like so much anecdotal evidence for using oils and like taking oral oils, eating lots of fat and protein, and drinking lots of water, and keeping in a healthy weight range and stuff that really helped my belly to just kind of like stay relatively normal for me, like what's normal for my body. Did I mind if Thomas had a look down there while I was pushing? No, I just felt like an animal in a field. And I just oh, hey little baby.
I have a small boy here looking for his lunch.
Oh, okay, lunch on the way, dear.
Here you go. Here is a tiny baby boy.
Yeah, you looked while I was pushing, didn't you?
Yeah. Yeah.
Was it horrible?
No, it was birth. Like it was, like I was
sacred
focused,
and beautiful, and
like I feel like any father would want to, see the miracle of birth.
How is the tear healing? How fast did it heal? Do I regret not having an episiotomy? There's loads of questions about that related to tearing. Baby with a big head plus a forceps was gonna happen, and I did all of the perineal massage, and my mum didn't have that experience, but you just can't anticipate these things sometimes. And so as you know, I had 3 tears. 2 were 2nd degree, 1 was a 3rd degree, which I have this handy little drawing to show you what that means. A third degree tear involves skin and muscles and perineal tissue, and it has partial anal sphincter involvement, and it does require stitches. The healing time for a third degree tear is at least 3 months, which I didn't know when it happened. I didn't know any of this when it happened actually. I just thought like a tear or a no tear, and I just was convinced I wouldn't tear. I didn't even know where the second degree tears were, to be completely honest. Like, I was keeping on top of my painkillers afterwards and stuff like that, but the third degree one, oh, I knew about that one. Definitely was very aware, like, you know, there'd be stinging anytime I went to the toilet, like for a pee. The first pee after birth, I was so scared because I had a catheter in. They had to put one in and out a few times while I was in labour to remove urine, and then they ended up leaving one in after the birth, I think for like 24 hours. And so yeah, that's the whole scenario. It's just a whole thing with down there. Like, if I look right now, it kind of looks the same as it used to, thankfully, but I can really feel where the third degree tear is. It's kind of firm if I press on it, and it's still stitched, and my GP told me that I had to get the stitch out, and then I went to the hospital and they said like, no, that has to stay there. So it's still healing, and it can get sore if I like move wrong and it gets tugged on and stuff. I am amazed at how the body heals and how like that whole area, because like my swelling right after birth was next level. And I had people coming in behind my curtain and like checking it and being like, oh my God, you poor girl. Would you like me to get you a cool pack for that? Like, you know, the legs had to be kept open. It was severe swelling. I think they used the word edema, and that was a shock as well. And then there was obviously stitching as well and tears, but it's most intense for the couple of weeks right after birth, and then after that, like, you know, everything all starts coming together and it's all fine. To the episiotomy question, because the guys doing the forceps stuff, like, they said, right, so are we going to do an episiotomy? And my husband was there and he was like, no, because he knew that I really didn't want one. I don't regret not getting one at all. Episiotomy is when they cut you instead of letting you tear naturally, and they've traditionally been done to prevent severe tears, and it was thought that they healed better than natural tears, but more like recent research shows that episiotomies can cause more issues than they actually prevent. Without one, there's less risk of infection and incontinence, all that gorgeous stuff, and also like natural tears have been shown to heal better than episiotomies. Even the NHS in the UK, like, they don't do them routinely anymore. Evidence doesn't support their routine use, and oftentimes someone will get an episiotomy and still tear as well, and then you've also got the episiotomy. So like, yeah, I'm really glad I didn't get one. I'll just let him nap here because otherwise this isn't getting done. But just a question, hemorrhoids question mark. If your partner's watching, just tell them to get out of the room, right? But this is just us. This is a girl talk, safe space. Bunch of grapes hanging from anus. No exaggeration. It was horrific, awful. One of the worst parts of the afterbirth situation. And they took some time to, like, you know, go back to their home. Go to their home.
Son of a bitch, Paul, why didn't you just go home? That's your home! Are you too good for your home? Answer me!
Baby's back with his dad. Yeah, the next question was about, like, the spinal block that they put in before they did the forceps, and like this whole part, like, I remember so much of labour and stuff, but this whole part was just such a blur, and like I felt nothing. I do remember that they did it during a contraction. Don't know why. I got very anxious right at the end going into the theatre, and I was kind of like on heightened, I just felt really detached from my body and everything like that. But I'm assuming they put some numbing injection in before, because I didn't feel that going into my spine. Like, I really didn't, and it was just like that. And then my legs felt like elephant legs, and it was horrible. I didn't enjoy having the spinal block at all. I know some people really love not feeling the contractions, but I felt more in control knowing what was going on down there than not feeling them, and then they're asking you to push when you can't feel it. And I think that might have led to how bad my hemorrhoids were, and possibly all of the swelling down there, because none of that was there when I was pushing by myself when Thomas was looking. All that came along right at the end. I've heard that not being able to feel what you're doing can affect those kinds of things, but I know a lot of people really, really love being able to just turn off those contraction sensations. I'm just the type of person that if I have like a bad headache, I'll usually stick it out rather than taking a painkiller. It's just personal preference. It's just the way I am. I'm not saying that it's better to deal with pain than not to deal with pain. People are just very different in where they feel safe, and I feel more comfortable and safe feeling what my body's going through than turning off the awareness of it. Like knowing that there's pain happening that I can't feel, that scares me, and I don't like that. So that's why I wanted to have a natural labour and birth. That was my preference going into birth. And next one was about how did I manage like the fatigue. People asking me how to cope with sleep deprivation and stuff. For those of you who don't know, I was awake for like 100 hours in a row or something like that, from the morning of the night I went into labour, then all the labour, and then the days after in hospital. I just was wired, hallucinating, felt like I was off my face on drugs, it was the worst feeling being that awake. But I think just some natural process kicks in, and like you're just kind of kept really alert and awake, and you just get through it. Like I am not someone who enjoys a lack of sleep. Like before the baby came along, I would easily sleep 9-10 hours a night, and now I'm up every 2 hours around the clock since he was born. And I've adjusted to that. Like I've really adapted to it, and you just get used to it. And I'm assuming that's just the body's way. Like how would so many humans exist? Like how would our species have gotten to where it's gotten? I don't know. Our bodies are capable of a lot more than we give them credit for, I think. Like I know they were really worried about how tired I was and stuff, but I just felt so in the zone. I think you'll know it yourself if you're not able. Like if you're too tired, and you will just say to them, how do you feel now? Do you have PTSD, post-traumatic stress disorder? I don't think I have post-traumatic stress disorder. Like, I'm actually shocked that I don't. I looked at the symptoms after I got this question. Like, I looked it up on Google and stuff. And, like, usually what would prompt me to want to go to a doctor to, like, get a diagnosis is if I've read something that, like, I'm like, oh, what if I have that or whatever. But the only symptoms, this huge list of symptoms and stuff of PTSD, and like I have had nightmares about the recovery, like being in the hospital on my own without people being able to visit whenever they want, not really enough staff, and just like the tiredness mixed with being dosed up on painkillers and having antibiotics pumped into me and the new baby, and I couldn't get out of the bed because of the catheter, and like I was itching all over from the spinal block, and there was a lot going on there. And I have had nightmares about that, and I've definitely had flashbacks of it. One other symptom I had was when we went for our checkup of my stitches and stuff, I saw the guy who in my birth video I explained that I had an unwanted vaginal exam. Like he didn't warn me, he didn't ask me, he just did it very forcefully. It was very aggressive, it was in the middle of a contraction, it was just awful. And yeah, I had written on top of my birth plan that I really needed talking through slowly, gentle, guide me through it, let me breathe through it if you're going to do a vaginal exam. Like I've always had physical issues with smears and stuff like that, so it was just awful. And I saw, and he's nice, like Thomas got on really well with him, this doctor, but like I saw him, and I was kind of like this, like doing my usual people pleasing bullshit, and then when he went away, like I started bawling to Thomas, and I was just sobbing, and I just had this physical reaction to that, to seeing him. He was like a trigger for like all the feelings I had then. But that alone is not PTSD. Like PTSD is a whole thing. So like no, but it's definitely left some scars, like emotional ones. I got questions asking like, did I feel pressure to hurry up, and like, am I going to be filing a complaint and stuff like that? Yes, I did. I sent an email to this email address with the HSE, which is they're your guys for if you have issues with any kind of experience on the Irish healthcare system, the public healthcare system, contact them. They need feedback for stuff to change, and my pelvic floor physio encouraged me strongly to contact them about that awful unwanted vaginal exam I had during my pushing stage. And I detailed my feelings about not being allowed to do unguided pushing, and my feelings on them having a time limit on the pushing time. I sent links to studies and stuff like that attached in the email. So yeah, that's been done, and I am so glad, because I would have not have been good. I didn't do it face to face. I was going to do it at the appointment, but I just chickened out. not a confrontational person, and with COVID they're not letting partners into appointments. My husband is so much more assertive than me, and because he wasn't there I just didn't feel comfortable, so I did it by email instead. The coward's route, but I don't care, because now it's all written out and it's gone to like the people who can make changes, because I just feel like if I said it he might have gone defensive. Like, you never know, human nature, like we can get defensive sometimes. Someone had asked, did I feel like the old Melanie died in birth and a new Melanie was born and stuff like that, and like in a way, like yes and no, because obviously I'm never going to be the same, and now like that child, him and my husband, like they are my everything, but at the same time I don't feel like I've lost me. I kind of feel like, say you had a house, rather than that the house has been knocked down and a new house has been built there, I feel like there's been a really nice, big, fancy, elaborate extension built onto the house. That's kind of how I would explain it. I can see how easy it is to just become a mother and nothing else, and never do anything for yourself, let go of all your hobbies. Like, I can see how that happens, because there's an appeal there, because your child is so interesting, and it would be very easy for me to just forget everything else and push everything else away. But it's so important, I think, for your long-term happiness, and you know, like the person that your partner married, and like the person, all like who your friends chose to be friends with, like no one wants to lose that person, and I don't think you should lose the essence of what makes you you. Being a mother becomes part of your identity, but it doesn't have to become absolutely everything. Any positive advice, this person thinks that my experience has terrified them, and like I would do it again in a second. Like, I don't think of anything negative about my labour. Like, yes, I didn't intend on that kind of a birth, and yes, I wasn't prepared for the recovery at all. Like, it was a shock, but sure, look, going through a difficult thing and coming out on the other side of it, like, those are the things that really build you. My positive advice would be to, yes, do hypnobirthing. It massively helped me. It helped me to cope with all that kind of stuff, put me in a very good mental space to deal with it. My biggest positive takeaway is that I am really looking forward to having another baby, and if I didn't have all of the physical stuff to deal with, I'd probably just like want to get pregnant again now. Like, I do want to have time just with this baby, but you know what I mean, like it was not that bad. It's just a very unique and once in a lifetime, gotta live through it to understand it kind of experience, and I'm really, really, really glad and grateful that I got to experience it. I feel very blessed that I was able to have a baby. A lot of people who want babies can't, and I think I would have massively regretted it if I, out of fear, didn't have a baby. Like, if I could have been given, if I was able to have the chance as that person to live the parallel life where I did have a baby and give birth and stuff like that, and I saw that, like, that's basically what the plot of my novel If Only is about. Birth is amazing. Standing up after it was awful. Going for my first poo after it was terrifying. All the trips in and out of the hospital, and like the sitz baths, and wearing big awful ugly cotton underwear for ages, and like, yeah, there's like so much stuff involved in it. I gave birth, I had a baby, there's a human being gonna have a whole life who would not have had that life if I didn't go through all this. And, you know, like, think about you and your life and everything that you know and everything you've experienced. Like, someone had to go through all this for you to have that. Like, isn't that not amazing? It's so amazing. And I did feel like it was a really spiritual experience as well. And, like, it's just such a sacred thing. It was just so amazing. And hard. Emphasis on the hard, but like good hard, you know. If you like this video, please give it a thumbs up, and definitely comment down below any other videos you would like to see from me, and subscribe if you've not already. And this was a nice chat. I'm going to go and wake up my little baby and give him cuddles. Newborn cuddles are my favourite thing in the world. And yeah, I'll see you again in another video very soon.